Hello guys, this is Dr. Ajinkya here. So today's lecture I'll be talking about the optic canal. Now in the last lecture we had discussed about the complete anatomy and contents of the superior orbital fissure, right? So today I'll be talking about the optic canal. So we all know that the orbital apex consists of two anatomical parts. Laterally is the SOF and medially is the optic canal, as you can see over here. So what exactly is the orbital apex? We can define that as the union, or you can say the place in the posterior half of the orbital bony orbital region where the four bony walls of the orbit come together, right? So these consist of two openings, or you can say two structures, the SOF and the optic canal. So why this optic canal is so important? I'll be talking about that exactly, because we have optic nerve and the ophthalmic artery as the main contents of the optic canal, and how this optic canal is related to the middle cranial fossa, the cavernous sinus, and the bony orbit anteriorly. So the cavernous sinus is posteriorly and the bony orbit is anteriorly. So I'll be talking also about the most important thing which all ophthalmic surgeons should study about, as well as the ENT final year residents should be knowing about, is the relationship. So if you can see on the screen right here, I can show you. Now I've turned this so that we are viewing this from the posterior aspect, and as you can see over here, wait a second. This is the region of the superior orbital fissure, right? And that is the region of the optic canal. So as you can see, this is a region of the optic canal, and that's the region of the superior orbital fissure. So we have optic nerve and the ophthalmic artery right here. As you can see over here, we have a anatomical diagram, as you can see over here on the screen. If I can just zoom this. So we know that the optic nerve lies, so this is a right side superior orbital fissure, a right side orbit. So as you can see over here, this is the right side. So the optic nerve is actually situated medially, and the ophthalmic artery is like a tiny circle situated inferior laterally to the optic nerve. But that is not the same. It keeps on changing. The course of the optic nerve course is similar and standard in all human population, but the ophthalmic artery doesn't stay the same. It keeps changing its course as we go from the posterior to the anterior aspect. So that is the main thing I'll be showing you today, the relationship between the course of the optic nerve and the ophthalmic artery. So all the ophthalmic surgeons should be well aware of this. I think the oculoplastic surgeons are well aware of this already. So all the skull-based surgeons should also be aware of this knowledge. So I'll begin with this. First, I'll be beginning with the anatomy of the optic canal. So as you can see, optic canal is actually a canal and not just a foramen. It has got three parts. If you can see the optic canal, so this is the left side, okay? As you can see over here, this is the left side orbit, and you can see this is the SOF on the lateral aspect. So the orbital end, so the part of the optic canal which you can see from the orbital side is called as the orbital end, and that is actually vertically oval. So as you can see over here on the right side as well, we can see this area. As you can see, this is the orbital end of the optic canal that is vertically oval, that is vertically oriented and is vertically oval. So if I try to rotate this and go in the center, you can see that the optic canal kind of turns circular. So as you can see over here, this is a canal which ends here. It starts from here and ends here. So the central part is kind of actually circular, and as you go behind the posterior most end, as you can see over here, the posterior end, which is situated completely at the posterior end of the lesser wing of sphenoid, it is kind of horizontally oval, okay? So the anterior part was vertically oval, the central part is circular, as you can see over here, and the posterior most part, you can see this region over here, that's the intracranial part, that is actually horizontally oval. So the dimensions of that are different. So the optic canal is not uniform throughout, it keeps on changing. So as you can see on the screen over here, the normal adult dimensions of the optic canal are attained by the age of 5 years. Okay, so its average length normally is 6 to 11 mm. So you can take roughly an average to be as 1 centimeter. So the optic canal is around 1 centimeter on average. The lateral wall is the shortest and the medial wall is the longest. As you can see over here, I just showed you the structure, this being the medial wall, this being the lateral wall, and as you can see over here, the lateral wall was this and this being the medial wall. So the lateral wall is the shortest and the medial wall is the longest. So if you get a short note on this in the theory exams, I think you can mention this point to have an extra leverage. So as I was saying about the 3 ends, its orbital end, its center, and its cranial end. So you can take a screenshot of this and you can keep this for the revision later on. So they have different dimensions as you keep from going anterior to the posterior. So I think the moment you go from the anterior aspect, it gets narrowed down. So 6, then 5, and then 4.5 mm. So it becomes actually narrow. So this was the anatomy, the basic anatomy of the optic canal. So if you take an X-ray, if in some condition a tumor like meningioma and optic nerve glioma, they may lead to unilateral enlargement of the optic canal, which may be detected on the X-ray films. So that you can have for your extra knowledge, so that the optic canal, as you can see over here, this structure can get widened. So it can widen in cases of meningioma or any other tumor of the optic nerve. So I think that's about the basic anatomy of the optic canal. So moving on to the second most important thing is directly the relationship and the contents of the optic canal. Okay. So as you can see over here, I'll be showing you this in a 3D anatomy. Now you have to remember this structure very carefully. So always remember the optic canal is medial and the superior orbital fissure along with the inferior orbital fissure is lateral. So now I'll be showing you the complete anatomy of the relation between the ophthalmic artery and the optic nerve. So I'll just add these structures over here. So I'm going to add the artery. I'm going to add the ophthalmic artery right here. So as you can see, I've just mentioned the ophthalmic artery on the 3D anatomy model. So similarly, I'll be adding the nerve, which is the optic nerve. So as you can see over here, I just have to find the optic nerve. There it is. So I have added the optic nerve as well. So if you can see from behind, as you can see from behind, you can see this is the right-sided orbit. That's the left side orbit. This is the optic nerve, right side. That's the optic chiasm, and that's the optic tract. So you can see very clearly that this optic nerve, which has a dural sheath covering over it, that's the meningeal covering over it, has also along with it the ophthalmic artery in the optic canal. So the ophthalmic artery, as I showed you in the photograph before, the ophthalmic artery is inferior lateral always to the optic nerve, right? The optic nerve is very huge as compared to the ophthalmic artery, which is very small. So if we start from posterior to the anterior, we know that the ophthalmic artery is a branch of the internal carotid artery. Now, internal carotid artery has got 7 different parts, for which I have made a separate video of that in my link. You can see that in the comments panel. I'm going to be putting up a link for that video. So the C6 part, that's the 6th part of the internal carotid artery, is called as the ophthalmic segment. So that ophthalmic segment gives off the ophthalmic artery along with the superior hypophyseal artery. Okay, so that's one basic you need to be clear about. So once the ophthalmic artery is given off here, it is always, remember, inferior lateral to the optic nerve. Okay, so it stays like that in the first segment in the entire optic canal. Remember, in the entire optic canal length, the ophthalmic artery will be inferior lateral to the optic nerve, as you can see over here. So this is always, remember, you are viewing it from the back side. This is the right side orbit. So hence ophthalmic artery is inferior. This is inferior and this is lateral. So this is medial, this is lateral. So if I turn this like this, as you can see, this was the entire area of the optic canal. Now you can see the optic canal has ended, and for a few millimeter distance, it keeps going straight anterior to the orbital apex, or you can say the optic canal. And just as soon as the orbital apex ends, you can see that the ophthalmic artery is taking a superior course right there. If I can zoom this even further for you guys and make it quite obvious, you can see the labeling. That's the ophthalmic artery. That's the ophthalmic artery. It's continuing to go above the optic nerve. It's no longer here, okay? It's no longer inferior lateral. Now what you can see over here is the lacrimal artery, okay? The main ophthalmic artery is going above the optic nerve as soon as the orbital apex ends anteriorly, okay? So this is the ophthalmic artery going above the optic nerve along with its branches, as you can see over here. So if I can turn this on the anterior aspect, you can see all the branches of the ophthalmic artery. So ophthalmic artery is the main artery in this region, and all what you can see over here are all the branches of the ophthalmic artery. So as you can see over here, this was a very same ophthalmic artery which is taking a superior course over the optic nerve. It's no longer inferior lateral. This is, I'm viewing from the orbital surface. That's the anterior view. So this becomes lateral, this becomes superior, right? So this is the ophthalmic artery coursing above the optic nerve on a superior note, and it's going from the lateral to the medial aspect. As you can see over here, it's going from lateral to medial aspect, and then it gives off the first branch, that is the posterior ethmoidal artery. What I mean by the first branch is the first branch on the medial aspect. That is the posterior ethmoidal artery, as you can see on the label right there. If I can just further zoom in this for you guys, it will be much easier for you. So this is the posterior ethmoidal canal for all the ophthalmic surgeons out there. So whenever you're doing a surgery, you have to be very careful that this at the fronto-ethmoidal junction, as you can see, there's a junction over here. This is a frontal bone on the labeling. This is the ethmoidal bone on the labeling. These two foramens, as you can see over here, that's the anterior ethmoidal artery foramen, and that's the posterior ethmoidal artery foramen. These are situated at the fronto-ethmoidal suture, okay? So the first medial branch is the posterior ethmoidal artery. Now similarly, the superior, the ophthalmic artery continues to ascend superiorly and medially. As you can see, it is not at the same level like this. It continues to ascend superiorly, and at a particular segment of it, after the posterior ethmoidal artery, you can see it is giving off a branch called as the supraorbital artery, okay? So if I click on the supraorbital artery, you can see the supraorbital artery has the most superior course, and it is coming out of the foramen, as you can see over here. It's called as the supraorbital foramen. So if I can just bring this down for you. So as you can see, the clear area of this. So this was the second medial branch of the ophthalmic artery, the first one being the posterior ethmoidal artery. This is the supraorbital artery coming out from the supraorbital foramen. And if I can zoom out this, you can see how the supraorbital artery traverses and courses over the frontal bone in the forehead region. Okay, so all these are the terminal branches of the supraorbital artery. So if we move on to the third branch of the ophthalmic artery, as you can see over here, this is the ophthalmic artery still in continuation. And as you can see, if I can rotate this from an inferior aspect, you can see this is the third medial branch. That's the anterior ethmoidal artery going out and coursing through the anterior ethmoidal skull base, through the anterior ethmoidal foramen, right? So that's the third medial branch. And then you can see over here, this is the main ophthalmic artery still coursing. It is still going on superiorly. So it's never straight. It's never at 90-degree angle. It's always going superiorly till its anterior most aspect. And once it reaches a particular point over here, you can see it gives off a supratrochlear artery. Okay, so as you can see, the supratrochlear artery coursing around the medial most aspect of the forehead, around the medial edge of the orbit, and it terminates into the supratrochlear artery and its branches. So I think this is one of the most terminal branches of the ophthalmic artery over here, and it further continues. Now this is, as you can see over here, this was the ophthalmic artery over here, and it terminates into the supratrochlear artery, and this one over here is the dorsal nasal artery. Okay, so this is how the ophthalmic artery courses through. Now this was a medial course above the optic nerve, but as you can see over here from behind aspect, if I can just zoom in this for you guys and keep it in the center. As you can see over here, this was the ophthalmic artery, the main branch, the main trunk. It is giving off a lacrimal artery on the lateral aspect. It is giving a central retinal artery as well. So as you can see over here, this is the central retinal artery. Okay, that is a branch of the ophthalmic artery as well. So if I can just give you a view like this and rotate this, you can see the lacrimal artery going off to the lacrimal gland area, and the central retinal artery, as you can see over here. I hope this is very much clear that this is the central retinal artery piercing within the substance of the optic nerve, right? This is a dural covering, and this is the central retinal artery piercing through and through the optic nerve contents. So it will supply the retina, right? So if you can see the very same retinal artery right here. Okay, so what exactly is this? This was the same central retinal artery which pierced it right there. As you can see over here, I can see it very clearly over here. I just want to click at this area so that there's light. So yeah, as you can see over here, this was that same artery, the central retinal artery, which pierced the optic nerve. So it pierces, follows a particular anterior course over here, and you can see that's the very same artery. You can see, I can just zoom this for you guys. You can see the same artery which is coursing through the optic nerve right there, and it's coming out and dividing into the central retinal artery right here. It is dividing the central retinal artery right here, and it divides into many branches up there. So all you can see, this is all central retinal artery. This is central retinal artery. This is also central retinal artery. These are all the branches of the central retinal artery that supplies the retina. So this is how the ophthalmic artery courses through. And as you can see over here, this is the lacrimal artery. The lacrimal gland lies over here, superior laterally. As you can see, this is all the further branches like the lateral palpebral arteries. This is the superior lateral palpebral artery. This is the zygomatic branch of the lacrimal artery. So all these arteries you can see coursing up like this. So this is a branch. You can see the same branch over here, the zygomatic branch of the lacrimal artery. That's the zygomatic facial branch of the lacrimal artery coming out of this foramen. So this is how you should study the ophthalmic artery relationship with the optic nerve. So without a 3D model, it is quite impossible unless you are a surgeon, a high-end surgeon, and going and digging in deep to find all these arteries on a cadaver. I think if after watching this video you can do a cadaver dissection, all you surgeons out there. So I hope you find this video really helpful for the ophthalmic artery and the optic nerve. So that's it. This is all about the ophthalmic, you can say the optic canal. So this video completes the entire anatomy of the orbital apex. So I've covered up the superior orbital fissure anatomy. I've covered up the orbital optic canal. So that together makes it the orbital apex, right? So as you can see, the optic nerve on the left side is completely so we all know that the optic nerve has a posterior medial course of direction, right? So I think this video is really helpful for you guys. So if you have any doubts or you need some clarifications to be done in this video, you can leave a comment in the comment section. I'll be happy to always reply to all your doubts and questions. And if anyone out there doesn't, if they want to learn something new, so see, basically I'm a skull-based surgeon, okay? I'm not an ophthalmic surgeon. I'm a skull-based surgeon. But most of the times, your medial eyeball or the medial half of the orbit, I have to always deal with. So I normally do surgeries of the medial half of the orbit, say for example, the optic nerve decompression, the orbital decompression. So I also need to know the anatomy of the optic nerve and the ophthalmic artery, because if in the sphenoid I open up the lateral wall, mostly in cases of pituitary tumors extending laterally, or any tumor that is extending in the supraventricular region, the third ventricle, or excess extension into the cavernous sinus, I have to open up the lateral wall as well. So in that case, the ophthalmic artery origin is very, very close. So the internal carotid artery gives off the ophthalmic artery, and if accidentally I damage that ophthalmic artery, the patient will go blind immediately. So legally, as a skull-based surgeon, I have to keep this anatomy always up to date whenever I'm doing a surgery, a skull-based surgery. So I hope this video is really important. And if you guys really need to go through some skull-based surgery books, where also there are a lot of theory and cadaver dissection about the transorbital approaches. So for the oculoplastic surgeons who are learning how to become an oculoplastic surgeon, the ophthalmic residents or the ophthalmic MS people out there, so you can just refer to the skull-based books. They have mentioned a lot of techniques, how you can go intraorbitally, externally as well as internally. So what other transorbital approaches you can use for tumors in the orbit. So everything is given in those books. So I've given the links of those skull-based books in my description panel. You can surely go and check it out, and if you want, you can buy it from Amazon. So I have a link for you guys, so you can just click on the link and purchase it. So in the next video, I'll be talking about the cavernous sinus thrombosis, the difference, how you can differentiate that from the superior orbital fissure, and also how you can identify and differentiate the superior orbital fissure syndrome with the orbital apex syndrome, which is also called as the Jacquard's syndrome. Okay, so I'll see you guys in the next video. Till then, take care. Thank you.